So my name is Dr. Vega, and I own Evolve Aesthetic and Wellness. The MiniTC, we've been using that for a while. Super easy to use. Super easy to use. The actual fat harvesting procedure is very, very well tolerated by our patients. Patients tolerate the procedure very well, do it on the local anesthesia. The processing itself takes, I would say, 20 to 30 minutes. But like I said, it's very, very simple to do. There's very well written structures, and like you said, Nathan has been a great help if we ever come across a hurdle while we're processing or anything like that. He's always right there. We can text him, we can call him, and he always answers our calls. Oh yeah, MiniTC will be a great addition to their practice, and based on the results that we're getting with our patients and also the ease of use, right? It's a very quick to learn process. And that can be done, right? And like I said, the product quality is amazing, results are good, and then the quality of the customer service too with Jointech. So we'll do a lot of I mean, the most things that you see is osteoarthritis, right? So we've done it for knees with osteoarthritis, as well as degenerative meniscus that is, most times is seen with the arthritis of the knee. We've done hips with osteoarthritis, and we've done some shoulders. Osteoarthritis in the shoulder is not that common, but some people do have arthritis, as well as like rotator cuff tears. So I choose Microfat over PRP based on severity, right? Severity, and it's also to patient's budget, right? Because that's a big thing, right? PRP is a lot less expensive to perform than the MFAT procedure, right? So, but mostly depending on severity, right? So, you're talking about like a mild, even though like even for mild arthritis, both PRP and MFAT would work, but at that point would be a patient choice. You make that informed decision making with the patient. Hey, listen, fat will be a better option